And now moving on to Hemex Care episode 2, introducing our next speaker, Dr. Lukman bin Shidek. He is a clinical pharmacist at Indiana Hospital and Heart Institute, Mangalore. Sir will talk about the emerging trends and pharmacogenomics novel treatments in hematology and integration of pharmacogenomics into practice. Very warm welcome to you, sir, and the stage is yours.
I'm a clinical pharmacist in Indiana Hospital. Uh, so I would like to talk about pharmacogenomics here. So pharmacogenomics is the study of how genetic variation affects an individual response to drugs by understanding how your genes influence how your metabolites and response to your medications. So in simple example, how I can say like is that like if you have like for example, if you and your friend take a citizen, uh, can anybody can respond me? So I'll be able to explain it. If three people can respond. Hello, hello, can you hear me?
Yes,
Yes, sir.
sir.
Yes, sir.
Yes,
Yes,
sir.
sir.
Yes, sir. So what happens? So this variation can be, there are four factors. One is absorption, distribution, and metabolism and excretions. So the main factors which can cause variation in all these metabolic changes, metabolism of the drugs. So we all know that P450 is the group of enzymes which is responsible for the metabolism of the most of the enzymes. You all know that, right? You all are in which standard? Like which year of founding? Does it include
Family second
first
year.
year, second year? Everyone
Second
is
year.
from second year.
I am
Yeah.
from second year, sir.
So so there are enzymes which is responsible for the metabolism of the most of the drugs. So P450 is a class of enzyme which is responsible for the metabolism of the most of the enzymes. So under P450, there are many enzymes. Like for example, SIP. Have you heard about SIP for SIP2E, SIP2C19, all these enzymes? Have you ever heard of that? Hello? Hello? Can anybody can at least one person has to respond to me probably. So I
Yes,
feel
yes.
like I'm
Audible,
just
sir. Audible.
talking to robot.
Audible.
Yeah, yeah, yeah. Have you heard about all these SIP2E1, SIP2C19, all these enzymes which is responsible for the metabolism of particular enzymes?
Yes, sir.
Yeah, yeah. All these enzymes will not be present in our individual like in same quantity. In some people will be having lesser of these enzymes. Some people will be having more of these enzymes. So what happens? The metabolism of the drugs occur, will not be same in every person. So that is the reason why this pharmacogenomics is important. See here, for example, SIM2EI, which is responsible for the metabolism of alcohol and CYP2C19, which is responsible for the metabolism of clopidogrel, and CYP1A2, which is responsible for the metabolism of caffeine, and CYP2D6, which is responsible for the metabolism of codeine, fluoxetine, then metoprolol, then CYP2. You can just see, right, instead of telling all these things. So there are particular enzyme which is responsible for the metabolism of particular medications. So here, I'm just giving you three examples. From that, you will be understanding why this pharmacogenomics is important. So how we can find out this pharmacogenomics? Do you have any idea? Like, is there any test for pharmacogenomics, finding this pharmacogenomics, finding all this genetic variability, alleles? Have any idea? No, right? Can you I want a person to respond to my word because I won't feel like I'm just telling to a robot. I'm not used to this kind of class, sorry. Hello?
Tapping.
Yeah, yeah. So I'm just giving you three examples. So three examples. One is codeine. So you know about codeine, right? Why this codeine is used? Codeine you might have seen it is used in cough syrups, all these things. Cough syrups, codeine.
Analgesics.
Codeine is opioid analgesics. Yeah. Other than that, it is usually we are using it as an antidepressant agent. You might have seen in the syrup and all. So what happens? This codeine will get metabolic. How the metabolism of codeine is this codeine will get converted into morphine, and from that morphine, this codeine will get converted to morphine by the enzyme CYP2D6, which I have seen, which you have seen here. CYP2D6 codeine. So what happens in some patients, like for most of the 70% of the Europeans, will be missing these genes, SYCCON. So what happens? Codeine does not work effectively in these patients. Understood? You're getting me right?
Yes, sir.
Yes, sir.
Yes, sir.
Yeah.
Yes, sir.
Then second example is, right, folic acid usually we are giving in the pregnant women. So now in modern practice, here isomethyl folate is given to the patient instead of folic acid. Why it is given so? You have any idea why it is given so? The
No idea, sir.
Yeah, yeah. Then what? So for that you need to know about this folic acid metabolism. So here folic acid will get converted into dihydrofolic acid, and from there it will get converted into tetrahydrofolic acid, and from there it will get converted into uh, 5,10 methylene tetrahydrofolate. And the last end product of this metabolism is I-methylfolate. Understood? Not iso methyl folate. You're getting me right? So if you're giving folic acid to the patient who have who does not have this methyl tetrahydrofolate reductase enzymes, this enzyme is responsible for the conversion of this conversion. So if you are giving just folic acid to the patient who does not have this enzyme, what happens? You're getting me right? If you're giving folic acid to the people does not have this enzyme or deficiency of this enzyme will not, there will be no conversion. So what happens? This folic acid will not be effective in this patient. You're getting me? You're
Yes, sir.
getting me right? Yeah. So that is the reason in modern practice what we are giving, if instead of folic acid, so isomethyl folate is giving. You're getting me right? So so the doctor will not test all the patient because it will be expensive, right? So this allele test will be expensive. It will be costing around 20,000 for the patient. So what happens? The doctor will not go for the test. The doctor will what happens? The doctor will just prescribe isomethyl folate to the patient. So this is the second example. And I'm just giving you the third example. You all know the mechanism of ethanol, right? How this ethanol metabolism takes place in our body. How does this act?
Yes, sir.
This ethanol, this ethanol will get converted into acetaldehyde. So this acetaldehyde have the side effects of this all the side effects like as flushing, nausea, headaches, all this. You know about disulfira?
സ്പോൺസേഴ്സിന് എല്ലാ പൈസയും ഓരോന്നും എടുക്കേണ്ടി വരും
Hello,
എല്ലാ പൈസയും ഓരോന്നും എടുക്കേണ്ടി വരും
which sponsors? Hello.
അല്ല എല്ലാ പൈസയും ഓരോന്നെ എടുക്കേണ്ടി ആ എന്നിട്ട്
Sir, please continue.
Sir, please unmute yourself, sir.
Sir, you're also on mute.
Sir, you are muted, sir.
Hello, sir. Sir, your mic is muted.
Yeah, can you hear me right now?
Yes, sir.
Can you
Yes,
hear
sir.
me?
No problem.
Yeah, sir. Yeah, sir.
Yeah.
Yes, sir.
How long I have been muted? How long I have been muted? Whether you were hearing all this ethanol metabolism.
No, sir, please.
Hello? Yeah, as I said, ethanol metabolism, ethanol will get converted into acetaldehyde, and from acetaldehyde, it will get converted into acetate and acetyl CoA. So this acetaldehyde, which can cause side effects like that, such as the flushing, nausea, and headaches in the patient. You know about disulfiram? Why that medication is used? Anybody? Disulfiram? Just write it and just. Disulfiram is a medication which we are
Alcohol
using.
and alcohol withdrawal
Yeah,
syndrome.
alcohol withdrawal, right? Yeah. How that is happening here? Can anybody tell me how that happens here? So what does this alcohol dehydration, this lysogram does is it will inhibit this enzyme, aldehyde dehydrogenase. So what happens? There will be no conversion of acetaldehyde to acetate. Understand? So as I told, this acetaldehyde can cause side effects like that, such as flushing, nausea, headaches, all these things. So what happens here? This blocking happens so that the patient will stop taking alcohol. Then because the patient will feel irritant to the while he is taking alcohol. So what happens here? This alcohol dehydrogenase will not be same in all patients. So that is the reason some people take alcohol and they'll get fit. They'll get that effect of ethanol very soon. Like for example, you will be telling that he get fit. He'll get after drinking one peg only he'll feel very so drunk. That is the reason why some people will be having more of this alcohol dehydration. On such kind of person, little of alcohol is enough to get this alcohol effect in this patient, in this not patient, in this people. So, and that is the reason. Some people will have very efficient alcohol dehydrogenase enzyme that breaks down the alcohol very quickly. This means they feel the effect of alcohol faster and may get drunk more easily. Others others have less efficient alcohol dehydrogenase, so it takes longer for them to feel these effects. Similarly, the as I told in aldehyde dehydrogenase, there are different versions of aldehyde dehydrogenase. Some common variations show difference in which if there is any difference in this medicine, like this enzyme, aldehyde dehydrogenase, what happens? So the patient can, these people can get disturbance such as flushing, nausea, and headaches. So this can happen in the patient who have the deficiency of aldehyde dehydrogenase. So all these tests, we can't do all these tests, right? As I told, it is very expensive. So it can be almost like 22. It costs around 20 to 30,000 for doing all these allele tests. So what we can do as a clinical pharmacist is like we need to know all these 3 450 enzyme inducers and inhibitors. Have you ever heard about these inducers and inhibitors? I think you might have learned from different pharmacology. Can anybody respond me? Hello, I'm audible,
Yes,
right?
yes, sir.
Yeah. So these are the enzyme inducers. I have made a code for that. CRAP GPS. CRAP GPS. CRAP. Here CRAP C for carbamazepine, R for rifampicin, A for alcohol, P for phenytoin, G for disophonoline, T for phenobarbital, S for sulfonylureas. So here what happens, here what this enzyme induces do is, it will increase the metabolism of these P450 enzymes. So if you're taking carbamazine pills, so what happens? It will increases the metabolism. What happens if it is increases the metabolism? If metabolism increases means it is breaking down fast. So it will decreases the concentration. It will increases the metabolism and it will decreases the concentration so that the effectiveness of that drug will get decreases. You're getting me right? Hello? Understanding?
Yes, sir.
Yes, sir.
Yes,
Yeah.
Sir.
Inducers, what the inducers are doing, all these inducers are doing, it will, I'm repeating because I think most of them are not understanding this. Enzyme inducers, these are the people, these drugs, whichever I told, crack GPS, are the enzyme inducers. Like they will induces this enzyme, increases the activity of all these enzymes. So what happens if you are taking any like alcohol, phenytoin, and any other drug which is metabolized by this P450 enzymes? What happens? This can increases the metabolism and decreases the concentration. So when you are increasing the when these inducers are increasing the metabolism, what happens? It will break down very fast, and the concentration of this drug will decreases. You're getting me right? So if you have taken this carbamazepine and any of other enzymes like any of other drug which is metabolized by this enzyme, it is metabolic. So what happens? It will decrease the concentration and there is no effect of that drug. And same like inhibitors, what they do? These drugs will inhibit and it will decreases the metabolism. That metabolism will not take place so that it will increases the concentration of that particular drug. You're getting me right? Hello,
yes,
you're
sir.
getting me?
Yes, sir.
Yeah. So
Yes, sir.
Yes, sir.
so for this you have code like quick save. You can just remember as quick save. If you want, you can write down these things because this quinidine because how you are finding this drug interactions and all combination. Hello. Do you have any app like Lexicon or up to date anything like
Lexicom and
that?
We have
Medscape, sir.
Yeah, Lexicon. That so that anybody can do right. Like finding interaction in Lexicon, anybody can do. So as a clinical pharmacist, as a pharmacy student, we need to know which all are enzyme P450 enzyme inducers and which all are P450 enzyme inhibitors. So as from this code, like Q say, quinidine, grape juice, isonic acid, chloramphenicol, ketoconazole, sulfonamides, amiodarone, valproate, erythromycin, all these are enzyme inhibitors. So it will decreases the metabolism. When enzyme is inhibiting, it will decreases the metabolism, right? So that if there is no metabolism, what happens? The concentration of the drug will increases, right? So there is a chance of getting drug toxicity. So can you just give me an example, like for example, like day-to-day example for this? How can we interfere with all these things? Like if a patient is taking carbamazepine and also any other drug which is metabolized by P450 enzyme. For example, you can take warfarin. So what happens? This there will be in the inducent, right? So what happens? There will be less effectiveness of for this carbamazepine. So if a patient came for seizure, so if a patient is came for seizure and you are not able to find any, if the doctor is telling the we are not able to control the seizures of the patient. And as a clinical pharmacist, we can just go through if there is any enzyme inducers or enzyme inhibitors is present in that patient chart. And like that, you can just do the intervention. So if you have any doubt in that, you can ask me. I'm not much into the teaching. That is why you might have felt any difficulty while I'm explaining. I'll be knowing things, but I'm not able to explain things that I understood after taking this lesson. So, if you have any doubt, you can ask me regarding this pharmacogenomics. Hello. If you have any doubt, if you didn't understand anything what I have told, you can ask me. Hello. Hello? Can anybody? No doubt.
It's clear, sir.
So I think, yeah,